Hi, and welcome to the show. Subscribe at kevinimney.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Karla Lester. She's a pediatrician, a certified life and weight coach, and today's Kevin MD article is GLP-1 medications like Wegovy are effective metabolic health tools for teens with insulin resistance. Karla, welcome back to the show.
Thanks for having me. I always appreciate the platform.
So Carla's been on multiple times. Go to kevinimney.com/podcast to hear her story in prior episodes. But today, let's jump right into this most recent one. And for those who didn't get a chance to read it, tell us what it's about.
Well, I'm, like Dr. Poe said, board certified in pediatrics. I'm also board certified in obesity medicine and certified life and weight coach. And I have a platform called IME Community, which is coaching and advocacy. And then I started a metabolic telehealth for children and adolescents practice that's licensed in 15 states over the last year. And I've been prescribing GLP-1 medications as part of it. And of note and of importance is that, I don't have any conflicts or disclosures or any ties to these pharmaceutical industry that produces these medications, but also I created my whole platform based on insulin resistance is the real epidemic we should be facing. And before myself even knowing, doing this work for so long, about the medications. So I have always viewed these as a helpful adjunct and that they treat the root cause of obesity, which is a side effect of insulin resistance. So I thought, well, I'm a year into this. I've learned so much. And as we know, each patient is different. And there are so many things that, I felt like I could share about the use of GLP-1 receptor agonist medications, especially in adolescents. And so in the article, I thought it would be best to go through like a case study.
Sure.
One of my patients, but it's a, compilation really of a lot of patients. It just shows that how, especially when working with adolescents, but with any patient, how this is a chronic disease. It requires chronic care management. We're going to meet them where they are, and it requires, a whole approach to health.
All right. So I want you to talk about that case study, but just for some context, what are some of the guidelines from various board organizations about the role of GLP-1s in teens?
Well, the FDA approved Wegovy or semaglutide based on the STEP Teens trial for adolescents aged 12 to 17 as an anti-obesity medication. And it showed many positive outcomes, not just weight loss, but decreased waist circumference and also many improvements in biomarkers compared to placebo. So they're very effective. So the FDA approved that. And then also the American Academy of Pediatrics came forward with clinical practice guidelines that said, let's intervene earlier, let's make the diagnosis of obesity earlier. And then in the past, we had these expert committee recommendations that called for a staged approach to treatment. And this is like basically do not pass go, offer these interventions at even the first visit. Those were obviously very controversial, but those are some guidelines that show, these medications can be effective and can be and should be a part of, especially when we're treating adolescents, because we all know that the data always shows that we just have like, okay, it's gotten worse, especially post-pandemic. Here we go with another round of increasing severe obesity in adolescents, and then absolutely nothing really to offer these teens except for just saying, okay, 80% are going to be obese adults. And then the study that I look at all the time and that I really base all my work around is the Today 2 study, which is a adolescent type 2 diabetes study that a lot of great information has come from. And really it shows that type 2 diabetes in adolescents is a more severe disease. They have early cardiovascular disease, and that it's refractory and not as effectively treated with the medications that we've been using. So for me, I really take this whole approach, and most of my patients, their parents find me on TikTok and they know, and they look at my website and they download my insulin resistance guide in teens, and they're like, there is something else going on here, because I do have a lot of, and physicians can start to believe their patients, because I do have a lot of patients who do have a pretty balanced diet and they're pretty active in sports, but they they really are stuck at a
Mm.
weight, and they may have other comorbidities. And so, yeah, there's the guidelines, there's the FDA approval, and then there's studies like the Today study, which make it's kind of almost a relief to have these medications like the GLP-1
Sure.
medications that could actually treat the root cause of it.
So tell me about this case then that you wrote about in the article.
Yeah, and I wrote the article because I was wanting to do like a year in review of teen metabolic health and all the things that have happened, but also a year in review of GLP-1 medications, because I was like, I'm licensed in 15 states. Every case is completely different
Yeah.
as far as causes, comorbidities, and contributing factors, which is what I look at. And then also how they respond to the treatment has been completely different. So I had two patients come at the same time, both really similar, like in ages, in BMI, and one's labs showed more insulin resistance type of a picture, and one had more genetic predisposition to metabolic syndrome, but relatively the same and same BMI. So it is, there's so many access issues to getting these medications. So we can't put all our eggs in that
Hmm.
basket, any of us physicians who treat patients with obesity. But so with this particular patient, the mom and I went through a lot with a prior authorization, appeals to get approval. So we're really excited. Then the national shortage of the Wegovy starting doses started, and it was another nightmare. It's like,
Hmm.
here we go again. So the mom found a pharmacy. We got her started. She tolerated it perfectly fine. We ramped up on the dose to the 2.4 milligrams, just as on schedule, no problem. And she had no weight loss. Whereas another patient, same situation, mom was able to find the starting dose of Wegovy. She started on the starting dose, she's lost 50 pounds
Hmm.
over the course of 8 months, and absolutely really didn't do anything else. But I was looking at this case when she hadn't, my patient who presented for follow up. And first, as a coach, we manage expectations and we allow disappointment.
Yeah.
Like, it's okay to be disappointment, but we're not disappointment. We're not going to make it mean anything. First of all, is this medication bioavailable to you? Like, are you actually getting the injection? Are you doing it properly? She was having some side effects. Does it matter where she's getting it? So we're troubleshooting and problem solving along the way. The other thing is, what are you noticing? She was noticing less craving. She was
Mhm.
noticing some appetite suppression from before. Then we went to all the nutrition stuff. Well, what are you eating? She's a very picky eater. So she had not changed or adapted her diet at all, except for adding in some protein. But when, they were kind of stuck in diet culture, and she was only getting 1,300 calories a day. And so it was like, your body is just stuck. I
Mhm.
mean, so we talked about thermogenic effects of food, how to increase your metabolism, rev it up with food, and do more balance of protein, healthy fats, and fiber. But also, I was like, let's check some labs. Let's see what other comorbidities may be going on. Does she have PCOS? Check the labs, and they were so improved. So it's like maybe the weight loss hadn't started yet, but her insulin resistance, she was becoming more insulin sensitive, more
Mhm.
insulin responsive. And her mom was thrilled because she'd been going to the pediatrician for so long and feeling that shame that we as parents feel that, oh my gosh, my daughter's
Sure.
cholesterol is high and the family has heart disease and all
Yeah.
these
Yeah.
issues. So she was like, oh my gosh, this is amazing. And so it is working. We just hadn't seen weight loss. So then what happened was, as she made some changes with the food and was starting to tweak and get a balance, and then was on that 2.4 for a longer period of time, she had all the other health behaviors in place, sleep and stress reduction, doing self-care. She's physically active. And so she started to notice weight loss. So she went from a BMI of I think 32.5 to around 28 or 27 something. So it's clearly working.
Hmm. What are some unique issues teens have when you're considering GLP-1 medications for them?
We have to manage their expectations
Yeah.
is the main thing, because it depends on the patient, because it's like, and this patient was really cool. I mean, and she was disappointed that she wasn't losing weight, and so was her mom. But especially after all that we had done. But it's also like it's going to be slow, most likely.
Mhm.
It's the rare patient where it's not going to be, and it's you have to do all of the other things in order to get the results. But the reality is, I've treated patients now with Wegovy, Ozempic, Zepbound, and Manjaro too. And I would say 20% of my patients have prediabetes or
Mhm.
actual diagnosis of type 2 diabetes. And it is so hard for insurance to cover. It's so frustrating for all of us physicians, but for teens too, if they're in that loophole of like their insurance won't cover anti-obesity meds,
Yeah.
but they have pre-diabetes according to adult criteria, and they won't cover for Manjaro or Ozempic because they don't meet the adult criteria for type 2 diabetes, which is not appropriate based on the Today 2 study. But anyway, if they don't kind of dial in with all of the health behaviors and really focus on everything, they may not get results,
Mhm.
or it won't be sustainable if for some reason they can't take it. And so I think managing expectations is one thing, but then I also have a lot of patients that it's really just not that big of a deal.
Yeah.
And I have some that it's like they take the dose, and I've had one where she took the beginning dose and she developed abdominal pain, and she just didn't like it. I mean, it was
Yeah.
fine. And she had one episode of vomiting, but she decided, I'm not taking that again. She doesn't want it. So you can have a side effect. And so you have to talk about all the
Sure.
possibilities. And then also, I really frame it up to look at all of health, and that, there's other medications and that we can use. Just because you try it and maybe it's not effective doesn't mean that it won't be effective later on if you try a different one as you get older, or that, there aren't other things that we need to look at going on. And so, I don't have a lot of drama about it. I also don't talk to them about long term, taking it long term. A lot of people say, why would you start them on something that they have to take for the rest of their life? Well, welcome to pediatrics.
Now, for those pediatricians that are listening to this, what are some characteristics of teen patients that would make them think that a GLP-1 may be the right medicine for that patient?
Well, first of all, I mean, for community pediatricians, I was one for quite a while, and it's really hard to have the time to write the prior authorizations, to do the appeals, to work on the, help the families navigate the shortages and side effects. And it's really hard. So I think that the AAP clinical practice guidelines are not that feasible
Hmm.
for a general pediatrician. But definitely for anyone, 12 and up, and especially if if their BMI is 27 and they have a comorbidity, or their BMI is 30, then they meet the criteria for a GLP-1 medication. Obviously, I do a lot of screening, a lot of talking about disordered eating, mental health issues. And I mean, all of that has to be taken into account. And you have to, as a pediatrician, you would get those referrals in to make sure that they're getting, treatment for their mental health diagnoses, and especially for their, if they have disordered eating, which I find a lot of my patients have some spectrum of disordered eating.
Hmm.
Um, so, but I think they should consider it for any teen, and parents know about it.
Hmm.
Many of the parents are taking them and they do fine. And so then the teen will be like, I want that. One thing I will say is that, for sure, I I am very against, and all my pediatric colleagues who do this work, we're all against using compounded
Hmm.
GLP-1 medications, especially for adolescents. I feel like if you're an adult, you get to make that decision for yourself, but I definitely don't prescribe compounded meds, and I wouldn't let a parent talk me into that.
So when we talk to adult patients, we talk about how GLP-1s are a longer term medication because the weight tends to come back if you stop those medications. You alluded to this earlier.
Yeah.
When that issue comes up, when you talk to teen patients in terms of how long they need to be taking these medications. What do you say to them? How do you manage those expectations? Just give us an example of that particular scenario in terms of how long they may need to take these medications.
Well, I do tell them, and they understand that it's a chronic disease and it requires chronic, management. And I also say that the medications are a helpful adjunct. They're one part of the puzzle. And so
Mhm.
we have to take advantage of taking these medications. And then they also have a real reality check when they work with me about like, there's accessibility issues. What if you have a side effect? What if you have, something else going on, you can't take it? There's always going to be different things. So we'll cross that bridge when we come to it. And I have a patient who has been really had a lot of success on the 0.25 milligrams Wegovy, who I was alluding to earlier. And we literally have this conversation every follow-up appointment, and we talk about what maintenance is going to
Mhm.
look like. And I really feel like we just have to kind of cross that bridge when we come to it, and just hope that, as things progress and there's more research done in adolescents with GLP-1 medications, my hope is that we will start having indication for prediabetes, that they'll have different indicators for adolescents with prediabetes, fatty liver
Mhm.
disease, and also PCOS.
Now, you mentioned side effects. In general, what are some side effects that teens need to consider? Are there any side effects that teens may be more susceptible to when it comes to GLP-1s?
Yeah, I think the number one that I would say is nausea. And it's never been too bad. The teens who I've worked with have reported waves of nausea,
Hmm.
maybe like the day of or the next day. And then some have reported some appetite suppression just like the first day after taking the dose, but they know that they'll make up for it later. So they don't worry too much about it because we don't restrict calories. This isn't diet culture. I've only had a couple patients who've had actual episodes of vomiting from it, and it's maybe been one, and when they first started it, and then they were okay. And then the issue with constipation, obviously, is one that we want to stay on top of because teens just kind of on a foundational basis aren't always getting their quality macronutrients. So they're not always vigilant about getting fiber in. So making sure that they are getting their protein in, getting their hydration, getting their fiber in, and maybe they take, supplements. But I have had some that struggle with constipation before, and we really talk about that, like how we need to go into taking this medication with getting on board with, your hydration and your fiber and maybe other treatments. But luckily I've only had one patient who was like, I'm not taking it, and she made that decision for herself, and good for her. I like, good for you to make that decision. Nobody knows how you feel, and everybody feels different with it. One of the tricky things is I've had a couple patients on the GLP-1s that have had gastrointestinal illnesses that are viral, and maybe they got that right after the injection.
Hmm.
And so they're like, oh no, is this the medication? And then we figure out that it's just the virus,
Viral.
but that can be a little bit tricky too.
We're talking to Karla Lester. She's a pediatrician, a certified life and weight coach. Today's Kevin MD article is GLP-1 medications like Wegovy are effective metabolic health tools for teens with insulin resistance. Karla, as always, will end with some of your take-home messages to the Kevin MD audience.
Well, what I want is for physicians to be open to all treatments that are available, to really, just start the conversation, start learning more about GLP-1 medications in teens, and really help them have more of a metabolic health approach so that they learn more about insulin resistance. And us as physicians, we're not taught that much about it, but look at the Today 2 study to
Hmm.
learn more about type 2 diabetes in adolescents and how these medications are potentially going to be really helpful. And The other thing is assess your patients. So get their labs. Don't just think that they're going to grow out of it, or be wary that you're going to cause harm if you have that discussion. This is something that these teens are really suffering with, and their parents really don't know how to move forward to help them. So really be the one to get labs, to talk about it, to learn more about insulin resistance, to learn more about the medications, and maybe how you could start prescribing them within your practice. And also, they're here to stay. So there's going to be a lot more, data and research coming out about these medications used in teens. So we might as well get used to it.
Karla, thanks again for sharing your perspective and insight, and thanks for coming back on the show.
Thank you.